I'm Amanda Halsey, and I'm going to be demonstrating how to hang a secondary medication. We already have our primary going, and so the doctor has ordered 500 milligrams of vancomycin to infuse over the course of an hour. What we have on hand is 200 milligrams per milliliter of vancomycin. So after the calculations, we need to draw 2.5 milliliters. Calibrating the drops per minute, it's going to be about 8 drops per minute, which comes out to about 1 drop every 7 or 8 seconds. Vancomycin, to start off with, is a antibiotic. Our patient has an infection. Lab values that we tend to see that are high are white blood cells. Side effects include things like nausea, vomiting, dizziness, headache, and if it gets bad enough, then superinfection. The dosage is usually weight-based, like we mentioned prior, but since we have a direct order from the doctor, then we just go by that. I'm going to now perform hand hygiene before I begin. I'm going to clean off the top of my vancomycin vial. And draw back 2.5.
Doctor ordered vancomycin, so.
Okay, so we have 2.5. I am then going to take another, clean off my port so I can put the vancomycin in.
That's why I say staff. I don't know. Just say infection.
Okay, there's no need to recap this, so then I would dispose of it in the Sharps container. I would then label my bag with the drug, the concentration, my initials, date, time, and the patient's initials. And then I will spike the bag. Since these are both covered, they are sterile, so there's no need to cleanse them off. Okay. And then I will head into the patient's room with my MAR. Knock on the door, introduce myself, let the patient know that we are hanging a secondary medication, and let him know why we are giving him vancomycin. It's to treat the infection that he has. Before hanging it, I'm going to squeeze into the drip chamber about halfway. I would perform hand hygiene and put on gloves before I touch the patient. I would palpate the site that the IV is at and examine for any phlebitis or inflammation, any infiltration of the IV site itself. Everything looks good, so I'm going to take an alcohol wipe.
Run your line.
Okay. Going to prime it first. Okay. Going to cleanse it. And there was a top on that, so I don't need to. Okay, and then going to release this roller clamp, and then calibrate about 8 drops a minute, which comes out to 7 or 8 drops, or 1 drop every 7 or 8 seconds. I'm going to monitor this and make sure that it's infusing correctly, and make sure that the patient is tolerating it well and that he's not occluding the site. I'm going to check on him periodically, and when it's done, I'm going to come back in the room and examine his arm once again. I'm going to clamp that and clamp this as well because it is done infusing. If the medication was going to be administered another time within a 24-hour period, I would just cap this off so it can be used at a later time. There. And then I would continue to infuse the primary med at the rate it was going prior to this, which was 100 milliliters an hour. And then I would record on my MAR the drug that was infused, the date, the time it started, when it ended, the site that it was, which is the right AC, how the patient tolerated it, my initials, and that is it.